Welcome back. So previously I had mentioned about SSRI, a short note on SSRI. Now we'll be moving ahead and we'll be looking at certain drug interactions. So this is going to be about drug interactions. So now when we look at TCA, that is tricyclic antidepressants, along with MAO inhibitor. So looking at what are the things that can be caused. So there are possibility of hypertensive crisis. There is also hyperpyrexia, convulsions, and coma. Now looking at TCA with alcohol or CNS depressants. So in such a case, there is potentiation of CNS depressant effect. Okay, now looking at TSA, nothing but it potentiates the effects directly acting sympathomimetic agents. Okay, so whatever acts on sympathomimetic agents act on this, it directly potentiates them. Now looking at TCA, it blocks the effect indirectly acting on sympathomimetic agents. Okay, so hope it's clear. Now again looking at serotonin syndrome. Next, serotonin syndrome. So this is when SSRI is given along with MAO inhibitors. It produces undesirable effects such as it produces tremor, restlessness, muscle rigidity, hypothermia, sweating, shivering, seizures, and ultimately coma. So again, another one would be it inhibits metabolism of drugs such as TCA, antipsychotic, phenytoin, carbamazepine, and also it increases their plasma levels. Now, just quickly recapping what I have told. So here we have discussed the drug interactions. So in this case, when TCA is given along with MAO inhibitors, so what is seen is hypertensive crisis and also hyperpyrexia and convulsions and coma. Now looking at TCA along with alcohol or the CNS depressants, so we can see the potentiation of the CNS depressant effect. Now as we know what TCA does is it potentiates the effects of directly acting sympathomimetic agents and it blocks indirect acting sympathomimetic agents. Okay, and next moving on, there can also be possibility of serotonin syndrome where due to the administration of SSRI along with MAO inhibitors, it produces many undesirable effects such as tremor, restlessness, muscle rigidity, hypothermia, and sweating, shivering, seizures, and also coma. And looking at SSRI, it inhibits metabolism, that is, it interferes with drugs, okay, such as tricyclic antidepressants and also antipsychotics, beta blockers, phenytoin, beta blockers as well, beta blockers, phenytoin, and carbamazepine, and it increases the plasma level. Okay. Now, moving ahead, let us look at some uses of antidepressants. So, uses. Where is antidepressants used? As the name suggests, it can be used in depression. Okay. And here, the main point would be SSRI are preferred over TCA, tricyclic antidepressants. And the points that favor this are there is better tolerability, okay, and there are also less side effects, okay. So due to the less side effects, they do not cause, there is less of hypertension and also decreased sedation, okay, and they also do not have anticholinergic side effects. Anticholinergic side effects is also less, okay, so there's decrease in anticholinergic side effects. Now looking further, there is no precipitation of convulsions also, and there is they do not cause cardiac arrhythmias, so there is no cardiac arrhythmias, okay. So these points are very important to know. Now moving ahead, even in anxiety disorders, so in case of anxiety, SSRI can be used, okay. So what is seen is the onset of action is slow, in case of SSRI. So what is done is benzodiazepines, BZD is also co-administered for short period to control anxiety during this period, okay. Now moving further, SNRI can also be administered, and example would be venlafaxine and also duloxetine. So these classification, it's already mentioned in the previous video, you can check that out as well. And also it can be used in case of OCDs, that is obsessive compulsive disorders, and the drugs used here can be clomipramine, okay, it is nothing but a tricyclic antidepressant, and also fluoxamine, it is fluvoxamine, okay, this is an SSRI, okay. Now I will just recap whatever is being covered in this page. So as we look at uses, it is antidepressant is used in case of depression, and in case of depression we have different choices of drugs, and the preference is always given to SSRI over TCA, and the reason being it has a better tolerability and there are less side effects, that is there's less chance of hypotension and sedation, okay, and there is decreased anticholinergic side effects as well, and they do not precipitate convulsions, and they decrease cardiac arrhythmias, okay. Now moving ahead, looking at a few other conditions, it can be used in case of anxiety disorder as well. So in case of anxiety disorder, SSRI is administered, but because of its slow onset of action, benzodiazepines can also be administered during this period. Now looking at use of SNRI is also used in case of anxiety disorder, and the examples being venlafaxine and fluoxamine. Now moving ahead, it can also be used in OCDs, that is nothing but obsessive compulsive disorder, and drugs included are TCA, that is clomipramine, and fluoxamine, that is nothing but an SSRI, okay. So these drugs are very effective, that is fluoxamine and clomipramine, okay, till now it's fine. Now moving further, it can also be used in ADHD. ADHD is nothing but, okay, it's drugs that can be used is ADHD is attention deficit hypersensitivity disorder. So in this you have TCA that can be administered, imipramine and nortriptyline. Okay, these drugs can be used, that is TCA, imipramine and nortriptyline. Now moving further, we can also use atomoxetine, methylphenidate, as well as dextroamphetamine. Okay, and it can also be used in case of nocturnal enuresis. In such a case, imipramine is effective, and it can also be used as the antidepressants can also be used in case of prophylaxis of migraine. So in such a case, amitriptyline can also be used, amitriptyline, and it can also be used in case of chronic pain, including neuralgias. Okay, so TCA is effective in trigeminal herpetic and post-herpetic neuralgias. Okay, and also the venlafaxine and duloxetine, that is nothing but SNRI, are used in treatment of fibromyalgia. So in case of fibromyalgia, SNRI such as venlafaxine, venlafaxine and duloxetine can be administered. And looking further, in case of atopic dermatitis, the topical doxepin can be used. It has anti-pruritic action, and in case of premature ejaculation, SSRI can be used. SSRI such as paroxetine, fluoxetine, sertraline, citalopram, daboxetine can also be used. Okay, and in case of SSRI not being tolerated, the TCA can also be used. In such a case, TCA can be used, and preferably flomipramine. Okay, pramine. Now moving further, clomipramine. Now moving further, I'll just summarize what has been done. Okay, so we have the continuation of the uses of antidepressants. So the main thing is antidepressant is not only used for depression, whereas it's used for other things as well. So in case of ADHD, we can use TCA such as imipramine and also nortriptyline, and also drugs such as atomoxetine, okay, atomoxetine and methylphenidate, and also dextroamphetamine can be used. And in case of nocturnal enuresis, imipramine is also effective. Now moving further, looking at prophylaxis of migraine, amitriptyline is used, And in case of chronic pain, including neuralgias, what is used is TCS can be used, that is tricyclic antidepressants. And in case of fibromyalgia, SNRI is used, preferably venlafaxine and duloxetine. Now looking at atopic dermatitis, in such a case, topical doxepin is used, okay, and it has an anti-pruritic action as well. And in case of premature ejaculation, SSRI is used, such as paroxetine, fluoxetine, sertraline, citalopram, as well as dapagliflozin. If SSRI are not tolerated, TCS can be used, and like clomipramine. Okay, so now moving further, we'll be looking at bipolar disorder, and this will be our last topic. So we'll be looking at bipolar disorder. So in such a case of bipolar disorder, the most common and important drug would be lithium. So lithium is nothing but it is the first drug for the treatment of mania. Okay, and the anti-epileptic drug such as carbamazine, sodium valproate, and gabapentin have also been used. So this is nothing but why we need to study lithium. It is nothing but the first drug which is involved in mania, and it can also include other drugs such as carbamazepine, sodium valproate, as well as gabapentin. Now moving ahead with the action. So the lithium, it reduces the motor activity. So what it does, it reduces motor activity, and also it decreases euphoria and relieves insomnia, and it stabilizes mood. This is very important. It stabilizes mood. Okay. Now looking at the action. So what happens is IP2. So IP2 is nothing but inositol. Okay. Inositol, a biphosphate monophosphate. So in this case it's biphosphate. IP2 is converted to IP1, and it is converted to inositol. Okay. So this is happening, and then what happens is it again breaks down to it goes to IP3 and then DAG, diacyl glycerol, and then it finally brings the FX. Okay. So what is happening here is IP2 is converted to IP1, and then it goes to inositol, and then later we have IP3 and DAG, and it brings the FX. So the lithium, it inhibits these steps. Okay, it inhibits this as well as this step. So here lithium acts and it inhibits these steps. Okay, and lithium, it inhibits the above steps that's mentioned here, and it reduces release of IP3 and DAG. Okay, it reduces these release, which are the second messengers for both alpha adrenergic and muscarinic transmission. So they act as second messengers. They are nothing but second messengers for alpha adrenergic as well as muscarinic transmission. Okay. Now moving ahead, lithium is a monovalent cation that can mimic role of sodium. So this is also important. Okay, and another point to add on is lithium, it decreases the release of noradrenaline as well as DA in brain, dopamine in brain. Okay, now just recapping what is discussed in this page. we have studied about bipolar disorder, and what we have learned is the lithium, it was nothing but the first drug which is used in case of mania. And looking further at other drugs that can be used in case of bipolar disorder, it can be carbamazepine. Okay, so it is carbamazepine. Yeah, it is carbamazepine. And then we have sodium valproate, and also it is gabapentin. Okay, now looking at the mechanism of action, so this is important step that needs to be known. So in this case, IP2, IP is nothing but inositol phosphate, and the 2 or 1 indicates mono or bi. Okay, so here IP2 is converted to IP1, and then it is converted to inositol, and later it leads to IP3 and DAG, and later it brings on the effects. Okay, so this lithium is nothing but it interferes with this step and this step. Okay, so ultimate result would be a reduction in IP3 and DAG. And we look at the function of IP3 and DAG. They are nothing but act as secondary messengers in case of for alpha adrenergic as well as muscarinic transmitters. Okay, now moving ahead with other points of lithium, it is a monovalent cation. So it is nothing but a monovalent cation, and it mimics the activity of sodium. Okay, and then it also decreases the release of noradrenaline and dopamine in brain. Okay, so it decreases the release of Na as well as Da in brain. Now moving further, we'll be looking at the other actions of lithium. It may produce diabetic. Okay, it may produce nephrogenic diabetes insipidus by blocking the action of ADH on collecting ducts. So this is by blocking ADH in collecting duct. Okay, so this is an important point to note, that lithium, it produces nephrogenic diabetes insipidus by blocking the action of ADH on the collecting duct. Okay, it increases the WBC count, that is leukocytosis, and it inhibits the release of thyroid hormones. Inhibits release of thyroid hormones as well. Now moving further, we'll be looking at some of the uses where it is used. So as mentioned earlier, it is used in case of bipolar disorder, and it also decreases the frequency and severity of both manic and depressive attacks. So it can be used in depressive attack as well as in case of manic attack. Okay, that's why it is known as a mood stabilizer. It is often known as a mood stabilizer. So lithium, it has a very slow onset of action, and it is not used in case of acute mania. Okay, because of its slow onset, not used. And it is also used in case of unipolar prophylaxis of unipolar depression. Okay, now moving on to the quick note on the pharmacokinetics. The lithium carbonate, it is effective orally. Okay, so it is not plasma, does not bind. So far most of the drugs we are telling that it binds to the plasma proteins, whereas in such a case it does not bind to the plasma protein, and it's distributed throughout the whole body water. Okay, it is not metabolized and gets excreted in urine. This is important point. It is not metabolized and it is excreted in urine as well as saliva as well as sweat. Okay, so this lithium is nothing but a monovalent as discussed earlier, And the kidney, the function, it acts in the same way as how it would act with the sodium. Okay, so what happens is the 80% of the filtered lithium, so 80% is filtered lithium, so it is again reabsorbed. Okay, it is reabsorbed in proximal tubule, and then what happens is the sodium depletion reduces the rate of excretion of lithium and also increases its toxicity. Okay, now moving on to the adverse effects, and before that I will quickly summarize so that it's easier. Now we have spoken about the actions of the lithium. So what we have seen is it may produce nephrogenic or diabetes insipidus by blocking the action of ADH in the collecting duct, and it increases the WBC count, that is nothing but leukocytosis, and it inhibits the thyroid hormone, that is nothing but T3 and T4. Moving ahead, we also spoke about the uses, that is it is used in case of bipolar disorder, in case of depressive and manic attack. And an important point to note is its onset of action is slow, so it is not preferred in case of acute mania. Okay, and in case because of its action as a depressive and manic attack, it is known as a mood stabilizer most commonly, and it is also used in prophylaxis of unipolar depression as well. Now we also added a few more points about lithium in case of pharmacokinetics. So here we have seen that lithium carbonate, it is effective orally, and an important point is it does not bind to plasma proteins and it is not metabolized, but it gets excreted in the urine and the saliva and sweat. And another point here to note is the kidney, it functions a similar way as how it would function with the sodium, because both are just a positive cation. And moving further, we'll be looking at some of the adverse effects. Okay, so in case of adverse effects, commonly with the respect to the GIT, there is nausea and there is vomiting along with diarrhea. And looking at the CNS, that is the central nervous system, there can be drowsiness, headache, ataxia, tremors, as well as muscular weakness, and also there is an important thing, that is slurred speech is noticed, slurred speech. Okay, now looking at the renal complications, that is a kidney. Here we have the polyuria, polydipsia. So here you may ask why. That is because of the inhibition of the ADH activity, and it also results in goiter with hypothyroidism can occur, and it can also result in lithium toxicity. So if a patient is suffering from has lithium toxicity, so the conditions would be confusion, convulsions, as well as cardiac arrhythmias, okay, and coma, as well as death. And looking at the treatment, okay, in case of lithium toxicity, there should be first thing is lithium should be stopped. Okay, and the serum level should be checked. IV mannitol should be administered. So why do we administer mannitol? It is nothing but to increase the excretion of lithium. And moving ahead, even IV saline can be administered. Saline is administered, and what it does, it restores sodium levels. Okay, and it promotes excretion. So this nothing but excretion of lithium is promoted, And next, hemodialysis can also be done. Hemodialysis, okay, in case of very high levels. Okay, so now I'll be summarizing this page. So here what is happening is the adverse effects, that is with respect to the GIT. We had nausea, vomiting, okay, and diarrhea, which can be seen. And with the CNS, that is the central nervous system, there can be tremor, okay, there can be drowsiness, ataxia, tremor, muscular weakness, and also the slurred speech can be noticed. And in case of renal, there is polyuria and polydipsia. This is nothing but due to the inhibition of ADH, antidiuretic hormone. And looking at goiter, hypothyroidism, it can also be a result of lithium. And then also there can be lithium toxicity, that is acute lithium toxicity. In such a case, the treatment would be to immediately stop the lithium, and the serum level is estimated. There is admission of mannitol, so mannitol is given so that there is excretion of the lithium. And then moving ahead, we also saw saline, that is saline is also administered to restore the sodium levels, okay. And because the sodium level is restored, it helps in easy excretion of the lithium as well. And hemodialysis can also be done in case of very high levels, preferably greater than 4 milliequivalents per liter. Now moving on, we'll be quickly looking at the drug interactions of lithium. So looking at the drug interactions, and this is of lithium, okay. So here what we are seeing is lithium along with the thiazides or furosemide. So what happens is these thiazides or furosemide, they cause hyponatremia, and as a result there will be increase in the reabsorption of sodium. So hyponatremia, so there's increased reabsorption of sodium in the PCT, and along with sodium, reabsorption of lithium is also increased. So there's also reabsorption of lithium. So what happens is there is increased toxicity. So lithium along with, okay, I'll recap in the end. So next we'll be looking at a neuromuscular blockade, and it is induced by a depolarizing, that is succinylcholine, and non-depolarizing, that is pancuronium, okay. And the neuromuscular blockers is prolonged in patients with lithium, okay. This is an important point. And then moving ahead, the lithium along with haloperidol, okay, may cause rigidity and can potentiate extrapyramidal symptoms of haloperidol, okay. So this is also done. So now I'll be quickly recapping what is being done. So we looked at the drug interactions, okay. So lithium, when administered with thiazides and furosemide, so it causes hyponatremia, okay. As a result, there's increased reabsorption of sodium as well as lithium and can lead to toxicity. And there's also neuromuscular blockade, okay. It is induced by depolarizing and non-depolarizing neuromuscular blockers, okay, and is prolonged in patients on lithium, okay. So neuromuscular blockers is prolonged in case of lithium. And next we saw lithium along with haloperidol. It is a long-term lithium therapy. It can result in rigidity as well as increase in extrapyramidal symptoms. Okay. Now moving ahead, we'll be looking at some other small drugs that can be used in case of mania and bipolar disorder, and a few points on them as well. So mania and bipolar disorder. So now going quick, we have sodium valproate. So it is a drug that is preferred in case of acute mania. And why is it? Because of its rapid action. Okay, and it has a great therapeutic index, wide therapeutic index, and it has a better tolerability than lithium. Okay, it is also can be used in bipolar disorder. Okay, and it can also be used in combination along with lithium or an antipsychotic, PSY psychotic. Okay, and divalproex can also be used in such a case. Okay, now we'll be quickly looking at carbamazepine. It is nothing but an anti-epileptic drug, Okay, it is nothing but a mood stabilizing effect. It has a mood stabilizing effect. Okay, it is used in treatment of bipolar disorder and can be used alone or in combination with lithium or valproate. So it can be used in case of combination with lithium, or it can be used in combination of valproate as well. Okay, it is less effective than, but the point to note is it is less effective than the valproate as well as the lithium. Okay, and it is used in bipolar disorder as adjuvant to lithium. Also be used in bipolar disorder. Okay, now looking at antipsychotics. Okay, here the famous ones are olanzapine, risperidone, okay, and also aripiprazole and quetiapine. Okay, these are just a few I have named. So they help in acute mania. Okay, and they are used alone or also in combination with benzodiazepine as well as sodium valproate. Okay, and also lithium as well. And conventional antipsychotics, such as it's also been mentioned a few slides back, that is haloperidol, along with fluphenazine, is also useful. Now I'll be quickly summarizing this page. So we have seen mania as well as in case of bipolar disorder. Okay, other drugs that are involved in this are sodium valproate. So it is a main drug in treatment of acute mania. Okay, why? Because it has a higher rapid action and it has a very good therapeutic index, that is wider therapeutic index. It has a better tolerability than lithium, and it is also used prophylactically for bipolar disorders, and it is used in combination of with lithium or an antipsychotic, and in such a case divalproex can also be used. So those were the points we had studied. And next, moving on to the carbamazepine. Okay, in case of the carbamazepine, we have seen that it has a mood, and it's an anti-epileptic drug. Okay, and it has a mood stabilizing effect. So it has a mood stabilizing effect, and it is used in treatment of bipolar disorder. It can be used alone or in combination with the lithium or the valproate, okay, as mentioned here, and it is less effective than the valproate and sodium. So these points needs to be known. And next we had moved to antipsychotics, examples being olanzapine, risperidone, and aripiprazole, and also quetiapine, okay, and they have help in the case of acute mania. It can be given along with administration of benzodiazepine, sodium valproate, as well as lithium in case of acute mania. And conventional drugs, antipsychotics such as haloperidol and fluphenazine can also be used. Okay, haloperidol and fluphenazine can also be used. Now, moving ahead, we'll be looking at other drugs such as lamotrigine. So in case of lamotrigine, it is nothing but a newer anti-epileptic agent. So it is used only in prophylaxis of depression in bipolar disorder. So it is used in case of depression, that too only in bipolar disorder. Okay, it can be used with lithium as well. So here what we are noticing is many drugs, they can be given along with lithium. And lastly, looking at benzodiazepine like lorazepam as well as clonazepam. So it is used in case of when patient is agitated. Case of an agitated patient, okay, it is used as adjuncts in case of agitated patients. Okay, now just concluding with the summary of the page. So we had discussed what is lamotrigine. It is nothing but a newer anti-epileptic. It is used only in case of depression, that too in case of bipolar disorders, and it can be administered along with lithium. And next we had also gone through the BZD, that is nothing but the benzodiazepine, and the examples being lorazepam and also clonazepam, and it is given as adjuncts in agitated patients. So thank you for watching, and in case you like it, please do give a like, and in case you have a suggestion, please do leave a comment. So thank you and have a good day.